Welcome everyone to this monthly Monday webinar series that we are doing in partnership with MaineHealth. So the goal of these webinars is to talk with different healthcare practitioners and help build awareness and knowledge for students who are considering career pathways in healthcare after high school. So we are really excited today to have Kellsey Michaud, who is a doctor of physical therapy. And we're going to have a lively conversation today about all the things that she does and kind of everything that got her to this point. So welcome, Kellsey. Thank you.
Thank you for having me.
We'll start pretty easy, I think, with just, could you talk about your individual career path? How did you get to where you are now? And like, did you always know that physical therapy or like within healthcare was going to be your path?
Absolutely. I love healthcare in general. I didn't know specifically I wanted to be a physical therapist. That didn't really come around until I was in high school, and I unfortunately got injured playing one of my sports. So I ended up in PT for a little bit, kind of fell in love with it then, stuck with it. I originally thought I wanted to go into outpatient physical therapy. But then as a student, you do all those clinical rotations, and I actually found my home and my love is acute care physical therapy. So that's how I ended up here at Maine Medical Center.
Oh, awesome. Thank you. And when you do those rotations, are they preset for you or do you get to pick the areas that you get to go into?
Oh, absolutely. Probably should have gone into that.
No,
I went to
curious.
Hacking University. So from there, we kind of give what areas we want to go into. Went to school during the time of COVID, so it was very difficult to get an acute care rotation at that time, just due to the circumstances of COVID. But they try and place you in 3 different settings, so you get exposure to a lot of different career fields. If you have a special interest in the area, they try and place you there. So for instance, if you had a really special interest in either pelvic floor or pediatrics, they try and find your rotation in which you'd get a little bit of exposure to those areas. And at the time when I was there, you had an 8-week rotation where you would go out to a clinic that they try and get you in a location that you like as well. So you go out, you do an 8-week rotation, and then the last 2 are 12 weeks. So you get to, under the guidance of a clinical instructor who helps you learn how to become a PT.
That's awesome. And I think I jumped ahead because you probably were going to answer that in the training and education, but I was just curious when it popped up. Okay, so where you are currently in acute care, could you talk about what a day in your life looks like? So all the maybe the things that you do, the tasks you perform, and what that environment looks like for so people can kind of get a sense, maybe who else you interact with on a day-to-day basis.
Absolutely. I interact with a lot of people on a daily basis. Definitely helps to be a people person. Some of the most common people, there are people that I talk to throughout a day that you would never even expect I'd be talking to. So a lot of doctors, nurses, SLPs, OTs. We talk a lot to safe patient handling is a department we talk to a lot here, as well as environmental services and patient transport, because all of those systems are very important for the overall safety and mobility of our patients. So I talk to them kind of on the daily basis, and our goal is to kind of increase the mobility of each patient and finding the best way that works for them. So I come in every day and I don't have a list given to me. I walk in, we're all assigned a floor or a unit that we are responsible for based off staffing and how many patients each floor has. We kind of delegate who goes where to help out in order to address every patient that we can. So we kind of go through our patient list, prioritize in terms of the must-sees and like the need to be seen. And then we kind of go from there. We clarify orders as we need to. So it's kind of different compared to outpatient. Outpatient, right. You tend to have patients that are scheduled in a specific time slot where we kind of make our own schedule.
Yeah, so you have a little bit more variety. And did you mention, and maybe you did and I missed it, is it shifts So is it like 12-hour shifts that you do? What does your schedule look like?
So there are varied schedules depending on the therapist, as long as there's even a way to kind of change your shift if need be. I personally work 8 hours, 5 days a week, with some weekends here and there. Um, so that's what I do. And I think the shift that I mentioned was more of where we are on the floor. So we do have floor rotations. Each floor kind of has a different subset of patient category to kind of help flow of patient care. Um, so we just change floors in order to distribute workload.
Got it. Okay. No, that's good to know. I just was curious about what that actually looks like for folks, like schedule wise, if they were going to be like a traditional, 8 to 5 type thing, or is it similar to like a hospital rotation, working in shifts like that? Actually, so we kind of talked a little bit about your education. So obviously you are a doctor of physical therapy. And could you talk about the level of training that takes? How long were you in school? And yeah, just a little bit about what's required of your position.
Sure. Like I mentioned previously, I went to school at Huston University in Bangor, Maine. They have a 6-year DPT program. At 4 years, I got my bachelor's in kinesiology, and at 6 years, I got my doctorate in physical therapy. Other schools have different variations. A common one is 7 years in order to get your doctorate. So kind of did the 6-year route, and it turned out well for me. In terms of workload, it just requires some summer and winter courses mixed in. But it was very manageable. They kind of lay it out all nice for you. What was the other part of the question?
No,
Sorry.
no, I think that was kind of it. And it's good to know every school's going to have a different way of approaching. So there's not necessarily a standardized approach to how they do the degree, and they're going to have different areas of specialty that you can choose from. So knowing that there is an option for Maine students is really nice to hear that you went to a local school, but there are other programs out there for sure that students could kind of look into. But I mean, at basis, you're looking at least 6 years of school. Okay,
Mhm.
sounds good. What kinds of interests or skills do you think would make someone a good fit to be a physical therapist?
There's a whole bunch of things. A lot of them are just being compassionate and caring and having a certain empathy for patients, especially in the acute care setting. We see a lot of patients at their worst moment. So being understanding and communicating that we understand that it's a very difficult time right now, and these are the steps that we need to take in order to help you get better. So having that level of compassionate care, and also just a love for learning. Physical therapy is ever changing. There's so many areas in which we're growing, we're learning new things are changing. So it's important to be able to look at all the research and determine what's the best plan of action, what's the best course, and saying, okay, we gotta change what we're doing because now evidence is showing something else is more beneficial.
Oh, that's interesting. So like the lifelong learning. So like, are there certain amounts of training or credit hours that you would have to do to maintain your license? Is that how that works?
Um, to my knowledge, right now in the state of Maine, we don't need any mandated continuing education hours. To my knowledge, at Maine Medical Center, we do have a policy to have a certain amount of continuing education hours, just to maintain our knowledge base.
Sure. That's awesome. Okay. One of the reasons like we're having these conversations with different areas of healthcare is that there is right now kind of a big shortage of essential healthcare workers across the board. I'm curious if you are seeing that within your realm, and what that kind of looks like, how that's impacting day-to-day operations.
Yeah, so The PT market is very tight. It's challenging for OT as well. But it's just not as tight as physical therapy is right now. We are now recruiting nationally, where like 5 or 6 years ago, we're recruiting more regionally, in terms of our facility here. In addition to the tight market, we also kind of have a niche market because we're a level 1 trauma center in a rural area. So finding people is a little bit more difficult.
Yeah, that makes sense. Okay. So there is a shortage. So for students interested in kind of pursuing that, that is not anticipated to slow down that shortage or that need, just from what I've been reading just across the board. So if they start going to school now, maybe we'll be able to keep some of them in Maine and practicing.
Come join us.
Yeah. We kind of talked about this before we started recording, but I even looked online. It's really difficult to narrow down what a salary range would be, what someone could expect. It's very geographically targeted. It depends on maybe the facility you're working in. I don't know. And maybe I stole your thunder there, but I don't think it's really hard for us. It's probably really challenging to give a range of like what a salary expectation would be when you graduate.
It's very challenging to narrow down a specific pay range just because of all the different areas that we can work in as a physical therapist. So I work in acute care, and that's different than somebody who's working at a skilled level rehab versus an acute rehab versus outpatient. So it's very hard to narrow down a specific range. For instance, here, we have the pay here is based off your level of experience, and we have a compensation department who kind of decides that for us. So it's really hard to narrow down without knowing.
Yeah. And I assume too, similar to kind of the market, when they're trying to recruit folks, that may fluctuate just based off of the need of trying to get people in. So thank you. And I know that that's not information that you can have readily available. But it's nice insight to see that there's a whole bunch of different, I think or at least what I think traditionally of physical therapy, I'm thinking of like a place that I went for rehab when I had an injury, but it's a lot more than that. You could work for a college or a university, you could work for a sports team, you could, so there's a whole bunch of different areas that you could work in. What could a high school student who's thinking that this might be an area they want to explore more, what could they do now while they're in high school or maybe over the summer to help kind of get them some exposure to this area?
So I would recommend shadowing a PT. Basically shadowing, you contact a place that you want to go and shadow, and you say, hey, I'm looking to shadow a PT, and hopefully they can fit you in. But it'd be nice to follow around a PT in a day and see what they do on their day-to-day, whether that be an outpatient or an inpatient, just to see if you like it, see if you have a feel for it. I know some of my friends personally got into school, even college level, and then they shadowed a PT and they're like, that's not really what I want to do. I'd rather go for occupational therapy. And then they were able to make a career choice that way. And likewise, I had occupational therapy students who were like, I shadowed a PT and I think I'm going to switch in there. So I think it's very helpful to see what we do on the day-to-day, because no one person can adequately describe what it is to be a PT. The other option is we have a position called a rehab aide. A lot of different places have them, in which you go and you're basically an aide for a physical therapy department or a clinic, and you help do tasks that they give you. But I think it's good to kind of keep on researching, keep on looking into it, talk to physical therapists. Even things like this are great. Watching a physical therapist struggle through how to talk about as a job, just to see if you like it.
No, you're doing wonderfully, by the way. So thank you for talking with us. It is hard to think about, like, you kind of go through your day, right? You know exactly what you need to do, but then when somebody asks you specifically, what it is you do all day, it can be tough to kind of come up with, you're doing a lot because you're not sitting down.
Right. And I think a lot of times it's just our main purpose overlaps a lot with many other disciplines. Like my goal is to help anybody we're a consult service in the hospital. So I get consulted to kind of look at how patients are moving, what their mobility is, if there's concerns about it, and help them progress towards what they were doing beforehand or what they want to be doing, what their specific goals are. And then we kind of make discharge recommendations based off what we see. So there's various ways to look at it, but we're all kind of addressing the same needs, no matter what setting you're in. You're addressing the patient's goals.
Yeah, that's important. And it's an important kind of distinction to make, like the baseline of what a person was able to do maybe prior to, or helping them get to a point of where they want to be mobility wise, or whatever it may be. This isn't a question I asked you to prepare for, so I realize I'm putting you on the spot, but I often hear students talk about athletic training and physical therapy as interchangeable. I don't know if that comes up a lot for you, but could you talk about that? Like, I imagine it's a level of schooling, and maybe you don't know for sure, but the differences between the two?
I'm not quite sure in terms of like schooling. I do know that our jobs are very different. So athletic training doesn't delve in as deep into like the physical therapy aspects in terms of needing rehab, making discharge recommendations, all that stuff. I'm not quite sure the clear delineation.
Yeah.
But that's interesting. We don't have any athletic trainers here, and I was never one. I do have friends who went to athletic training school before they became a physical therapist. So
yeah, I was curious if it was like a common thing that comes up, because I often just hear that from students quite a bit. I'm going to be an athletic trainer or a physical therapist, and I imagine that they're quite different career tracks, but that they lump them together sometimes. So just
they
curious.
just come together. I just don't know
Yeah,
the specific differences between them.
Yeah.
But like I said, I did have a couple of friends who were athletic trainers, and then they decided to go to PT school for one reason or another. So
Yeah. So it could be a pathway.
could be.
What do you like best about the work that you do?
I love seeing my patients progress. So I oftentimes see people who are unable to sit up by themselves, stand by themselves. So seeing them progress from there to standing, walking, using devices that they weren't before, but moving better. That's what I like to see. I like interacting with patients and their families, trying to find safe discharge recommendations and seeing how we can work together to make their goals happen. That's what I like most.
What? Yeah. No, that's good. And knowing that you're going to be sometimes working with a whole family, not just the patient directly, that's good to know. And then maybe the flip side of that is maybe what is one of the more challenging aspects of the position that you have?
Probably for me would be the prioritization of patients.
Mm.
Just because it takes a while to prioritize patients. Unfortunately, we can't see everybody all day, every day. So it's really hard to prioritize my time among so many patients. But it gets easier the more time that you do it, and you get better with your time management. I started as a new grad, so we're now at the point where it's still a little bit difficult, but it's great. And you always have plenty of support to help you through that process.
That's good. That's good to hear. Well, that's actually the last official question I have for you. So thank you so much for your time. Do you have any closing thoughts or things you want to say, to words of wisdom for students?
No, like I said, just kind of keep with it. There are some parts during school where you're like, oh my gosh, this is such a long time. Why did I do this? But it's all worth it in the end. It's a great career. I couldn't recommend it enough. I love what I do every day, and I think that's kind of the goal in finding what you want to do. Um, so yeah, I recommend it. But definitely go out there, shadow, research it a little bit more, see if it's a good fit for you.
Awesome. Well, thank you. We really appreciate you sharing your expertise and experiences with us. And I know the students are going to find a lot of value in this conversation. So thank you very much.
Thank you for having me.